I've been in practice since 2005, and I've come to understand that as an acupuncturist and Chinese medicine practitioner, my role is almost as something of a facilitator. Someone comes to see me, we sit down, I take an extensive case history, and then I put suggestions on the table for us to consider. And it's very important to me that the treatment process is something that you feel like you can maintain. I've also come to understand that the people who have the best outcomes, I think, with the type of treatment that I offer are people who do take an active role in their recovery, who are engaged and think about their recovery on a day-to-day basis. I think it's also important that people need to make time for their appointments and they need to keep them, because acupuncture and Chinese medicine is an incremental therapy. And by that, I mean that you come for treatment and then we show some progress and then we build on that with each subsequent treatment. So if appointments are skipped or not kept, then the recovery process is slower. It's also important, I think, to know that if we're working with a condition that is something that you've had for a long time, that it can sometimes take a little while to correct that. So getting better does take time. And I think the final thing is that all conditions, especially if they're more chronic in nature, sometimes benefit from some dietary modification or some lifestyle suggestions. Again, these are things that are offered as ways of you being able to do some things at home to help with your recovery. And it's offered in the spirit of helping to help you get better more quickly. I treat everything. I obviously have a well-established history of working with men and women who have fertility issues and gynecology. I've done a lot of work with women who are pregnant and also in IVF support. But I also have a great passion for just general acupuncture and helping people with acute and chronic type conditions like autoimmune conditions, poor digestion, poor sleep, stress and anxiety.